A local doctor is the new chairperson of the South Island Strategic Planning and Integration Team. General practitioner Dr Carol Atmore of the Mornington Health Centre replaces former chair David Tulloch, and she joins us to discuss the role and what she hopes to achieve. Good evening.
Hi.
What is the South Island Strategic Planning and Integration Team?
Well, it's a bit of a mouthful and we call it SPATE. So SPATE is part of the South Island Alliance, and the South Island Alliance is the 5 district health boards of the South Island coming together to work on the aspects of health services in the South Island that are best managed with a regional approach.
So how does it fit in with the Southern District Health Board and others?
Well, so SPATE is the link between the senior leadership of the South Island Chief Executives and the boards of the South Island District Health Boards, and the work that happens across the region in different areas, for example, child health, healthcare of the elderly, information systems, and so the district health boards actually form the South Island Alliance.
What is your role as chairperson? What does that involve?
Well, the SPATE is the link between the strategic work that happens from the chairs and chief executives and the work of the different work streams, and so as chair I want to be leading the work to work on that, make sure that the outcome measures are followed and that the outcomes for the South Island health system are met by the work that happens.
What are the challenges in this role?
Well, there's a lot of work going on, and we want to prioritise the efforts to achieve the best outcomes for the South Island health system. Another challenge is that we want to make sure that we aren't burdening the people doing the work with lots of measures that they have to meet over and above the measures that we already collect.
How are you hoping to make a difference in this role?
We want to keep progressing the work of the South Island Alliance, and we want to keep making sure that we focus our energies where we're going to achieve the outcomes that are going to improve the health system of the whole of the South Island.
Now, you used to work on the West Coast. What brought you to Dunedin?
We came down really for education. We've got teenage children and we thought it was a good place for them to be, and we followed them.
And tell us about your background in health organisations.
So I'm a general practitioner by background, and previously on the West Coast I was Chief Medical Officer for the West Coast District Health Board.
How are public health services changing?
Well, changing in a number of ways. Certainly there's a greater focus on care being provided in the community, and there's also a greater focus on teamwork, so doctors, nurses, physios, pharmacists, other allied health working together. And I think the other thing that is developing is more a whānau ora approach, so health working with education, housing, employment to improve the wellness of people in general.
What is prompting those changes?
Well, there's a number of things that are causing that. The population is ageing, and therefore, and with that, people are living longer with long-term health conditions that come about from lifestyle, so smoking, obesity related. So people are living longer with more complicated number of health issues, and also the workforce is ageing as well.
Do Dunedin residents have adequate access to health services?
Well, there's always more services. Everybody would like more at times, but across the whole of the South Island, including Dunedin, people have access to high quality health care services. Well,
congratulations on the role. New chairperson of SPATE, Dr Carol Atmore. Thank you so much for your time.
Thanks, Rebecca.